Have you ever experienced toothache? That throbbing, painful feeling that makes you feel like your head wants to explode? Toothache can be really bad, and I personally wouldn't wish that on anyone. Hi, I'm Dr. Neye, and in today's video, I'll be talking about how to deal with toothache and ways to prevent it. There are basically two types of toothache. You have the primary toothache, where the cause of the issue is from the tooth itself. So cases like dental cavity, abscesses, or even a cracked tooth. And then you have the secondary toothache, where the cause of the problem is from the supporting structures or the surrounding tissues, like the jawbone and the gums. So what are some of the symptoms of toothache? The symptoms can actually vary depending on the cause and the severity of the problem. But some symptoms include pain in and around the tooth, sensitivity to hot and or cold food and drinks, difficulty or pain when chewing or biting, swelling in the gums or on the face, especially when an abscess has formed. You can also have bad breath, and some people can actually experience some degree of fever, especially when an infection has set in. Most times, toothache actually sets in when you don't expect it, so you may not be close to a dentist at that particular time. So these are some remedies you can actually do to help give you some relief until you are able to get access to a dentist. Some tips include: avoid chewing on the side of your mouth where the tooth is. This will help to reduce pressure and ease the pain. Make sure to eat soft foods, or preferably foods that you can easily swallow, because chewing on hard, crunchy foods can cause you pain. Rinse your mouth with warm salt water. This will help to reduce any present inflammation. And also, salt has antibacterial properties, so this can help to actually kill bacteria. You can also take some over-the-counter pain medication. This will help to reduce pain and inflammation, but please make sure that you follow the instructions on the label. If you have any swelling, you can apply a cold compress to that particular area, because this can actually help to reduce the pain and swelling. Have you ever had toothache? If yes, please kindly share some tips and remedies that you use in the comments. Remember that these are just temporary measures until you can get access to a dentist. Is it possible to prevent toothache? Yes, it is. And the best way is by practicing good oral hygiene. This includes brushing your teeth properly twice daily, flossing at least once a day, and making sure that you schedule regular dental checkups and cleaning at least twice a month, that is every 6 months. Additionally, you also want to make sure that you limit your intake of refined carbohydrates like your candies, your snacks, and even your energy drinks. These contain a lot of sugar, which can predispose you to dental cavities. And of course, dental cavities, the deeper it is, can eventually affect the nerve, which can cause toothache. Like they say, prevention is always better than cure. But if you couldn't prevent it, remember that an early diagnosis can actually give a better prognosis. So don't wait until your tooth is extremely bad before you visit a dentist. I really hope this video has been helpful. If you have any comments or questions, please leave them in the comments. You can like, share, and don't forget to subscribe so that you can get to know when I post new videos. And I will see you in the next one.